I can have and do it all, said the 21st century parent. New age parents are in a time where they're trying to cement their places within every space that they occupy. They are entrepreneurs, corporate mavericks, husbands, wives, and parents. But taking up so much can mean one of these things will suffer, particularly the responsibilities of being a parent. Babies need, amongst other things, to keep to a schedule of immunizations and monthly weight checks at health centers. You find, however, that because of their busy calendars, keeping to these schedules is a bit of a hassle, which ends up creating a gap in their children's health welfare. Realizing this, the Always Open Clinic, or AO Clinic in Gaborone, stepped up to bring the home-based welfare service to their clients, where children get weight checked and immunized from the comfort of their homes. This exercise ensures that parents are more productive, more engaged, and more focused at work, knowing that their children are receiving the mandatory health benefits at home, regardless of whether or not they as their parents are present. How exactly does this initiative work? Wellness manager at the AO Clinic, Dennis Sibanda, speaks on this in detail.
We realized as AO Clinic that a lot of people are too much swamped. Actually, they are engaged on their daily life basis and chores. So this actually makes it very difficult for them to access healthcare facilities, to go and bring these children for immunization. Therefore, that leads to a high rate of not adhering to immunization schedules. It also leads to them defaulting from these immunization schedules. Therefore, as AO Clinic, we embarked on a home-based care where we actually go and bridge this gap. We are simply saying we are bringing child welfare services to your house, to your home, where you can actually register your children, where they can actually get all these immunizations according to Botswana immunization schedules. So this is also a way of enhancing adherence. This is a way of also making sure that our clients do not default from these immunization schedules, therefore enhancing the health of each and every child. We have also ventured into health financing. When you come with your health problem, instead of us thinking about administering a program with you paying, we can literally finance you. Then at the comfort of your wallet, you can also now start slowly but surely administering all those health bills.
One may wonder though, what assurance do clients have that the required safety and quality standards received at the clinic for these schedules will be adhered to during home visits? Stembile Matambo, who's home-based health service nurse at the AO Clinic, is here to speak on just that. So Stembi, thank you so much for coming here on First Issues and affording us your time. Perhaps before we go any further into the actual initiative, what is a child welfare schedule? What does it look like? What does it aim to achieve?
It's very important for mothers to make sure that the babies are immunized and also that they are weighed. A healthy baby is an intelligent baby and becomes a very important citizen. Now, when we visit at home, we don't create a new will. We follow the Ministry of Health protocols.
One may wonder about the safety and security of this exercise when received at home. So, as far as, the sterility of the equipment used when immunizing, the safety of the vaccines themselves, how are you allaying the fears that may arise from this by your clients?
We have sterile packs that we take, as you can see. We have needles that are sterile. We have even plasters to plaster at home. So when we get home, we still follow the protocols that are supposed to be followed to maintain sterility and to maintain safety. We also have a chance to sit with our clients one-on-one, allay their anxieties first, explain what you're going to do, which you rarely find in the hospital, before you can give the injections. By the time you give injections or the oral vaccines, they already know what you're going to do. what the advantages are, what side effects are likely to happen.
Let us talk about records keeping, because there's certain information that is required from yourselves after this exercise by the Ministry of Health through the DHMT. So how does that work? How do you provide for it?
Health information is very important because it guides us on how much is needed by the country, how much we've done, and what areas need to be strengthened. So when we go out to the homes to do immunization and weighing, we will take information from the child welfare card. And this information, we bring it to the clinic and we enter it. Our weights are entered here. Is the baby's weight normal? If it's not normal, we circulate at the right place. Are they on time with their immunizations? And at the clinic also, we have this chart. This is for the immunizations that we give. So this information, we compile it and we send it to DHMT at the end of every month.